So now we're going to start the nose. So now nose we're going to take the section in the sagittal plane. So we're going to see the medial wall of the nose, nasal septum, and the lateral wall of the nose. Okay, right. So now the medial wall. So the diagram we are seeing the medial wall. Medial wall is also known as the nasal septum. Now medial wall or nasal septum mainly formed by three structures, two bones and one cartilage. The two bones are the perpendicular plate of ethmoid bone, this one. This is the perpendicular plate of ethmoid bone, okay, and this is vomer bone, and this is septal cartilage. Septal cartilage is having four sides. See here. So septal cartilage also known as quadrangular cartilage. Okay, the other name for the septal cartilage. So these are the three main contributions for the nasal septum: perpendicular plate of ethmoid bone, vomer bone, and the septal cartilage. Two bones and one cartilage. Now we also have minor contribution. Okay, so minor contribution by the nasal spine of the frontal bone. This one, that is the nasal spine of the frontal bone, and this one, that is the crest of the nasal bone. This part, that is a rostrum of the sphenoid bone, and we also have the crest of maxilla, and crest of palatine bone. Okay, these are the minor contributions. Okay, so please write minor contribution is by nasal spine of the frontal bone, number one, crest of nasal bone, rostrum of sphenoid, crest of maxilla, and crest of palatine bone. Okay, yes, this is a minor contribution. Now one important thing is, now we have one special type of suture between the rostrum of sphenoid and the vomer bone, and that is called Schindleis suture. Schindleis suture is the special type of suture. In some books they are mentioning it is the joint, Schindleis joint they are saying, but strictly speaking Schindleis suture only. It's a special type of suture. It is a ridge and groove suture. Okay, so that is present between the rostrum of sphenoid bone and the vomer bone. So the special type of suture between the rostrum of sphenoid and vomer bone is a Schindleis suture. Okay, spheno-vomerine joint, spheno-vomerine suture. Okay, right. Next, we're going to see Little's area. See, Little's area is nothing but it is the highly vascular area in the antero-inferior aspect of the nasal septum. Little's area is the highly vascular area in the antero-inferior aspect of nasal septum. Antero-inferior aspect of nasal septum. Now, why it is highly vascular? It is highly vascular due to anastomosis, due to Kieselberg's plexus. It is highly vascular because of anastomosis, artery anastomosis, Kieselberg plexus. Now, what are the arteries involved in the Kieselberg plexus? See diagram. Now, this is our Little's area, antero-inferior aspect of the nasal septum. Okay. Now, what are the arteries involved in the Kieselberg plexus? Number one, anterior ethmoidal artery. Number two, sphenopalatine artery. Number three, greater palatine artery. And number four, the septal branch from the superior labial artery. Septal branch from the superior labial artery. So we have four branches: anterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and the septal branch of superior labial artery. Now please remember which artery is not involved in the Kieselberg plexus. Our posterior ethmoidal artery, it is not involved in the Kieselberg plexus. Okay. Now one more thing you have to know, the sources for these arteries. Now anterior ethmoidal artery is a branch of ophthalmic artery. Very good. Anterior ethmoidal artery is a branch of ophthalmic artery. And ophthalmic artery is a branch of internal carotid. your sphenopalatine artery, greater palatine artery. I told you in the maxillary artery itself, in the sphenopalatine fossa topic discussion itself, I told you, we discussed the branches of maxillary artery. Now, greater palatine, sphenopalatine, they are branches from third part of maxillary. So, maxillary artery is the terminal branch of external carotid artery. Again, superior labial artery, septal branch of facial artery, and facial artery, branch of external carotid. So, now the arteries which are taking part in the Kayselberg plexus are coming from external carotid artery only, except only one branch. Which branch? Anterior ethmoidal artery. This is coming from internal carotid. So, please put one small box and then write all the arteries which involved in Kayselberg plexus, are derived from external carotid artery, except only one branch. Which branch? Anterior ethmoidal artery. Except anterior ethmoidal artery. Now, anterior ethmoidal artery is a branch of, very good, internal carotid artery. Okay, right. So, that's all about the nasal septum. So, now we're going to discuss the lateral wall of the nasal cavity. See, lateral wall of the nasal cavity, we have turbinates. Okay, so we have three turbinates: superior turbinate, middle turbinate, and inferior turbinate. So, we have three turbinates. Okay, right. So, you see some elevations in the lateral wall of the nose. Now, superior turbinate and the middle turbinate, they are the parts of ethmoid bone. Superior turbinate and middle turbinate, they are the parts of ethmoid bone. Whereas inferior turbinate, it is not a part of ethmoid bone, there is a separate bone. So, inferior turbinate, please write, it is a separate bone. It is not the part of the ethmoid. Inferior turbinate is like the frontal bone, vomer bone, sphenoid bone, like a separate bone, not a part of ethmoid. Very often we are getting this question. Okay, so inferior turbinate is a separate bone, not a part of ethmoid. And in the lateral wall of nose, we see the sphenopalatine foramen. See the diagram? Yes. So, sphenopalatine foramen is just behind the middle turbinate. So, sphenopalatine foramen, which communicates the nasal cavity, the lateral wall of the nasal cavity to pterygopalatine fossa. Pterygopalatine fossa. I hope you know that. Already we discussed the same in the sphenopalatine fossa topic, communications. So, sphenopalatine foramen communicates nasal cavity to the pterygopalatine fossa or sphenopalatine fossa. Okay. So, now any cancer from the nasal cavity, the cancer go to pterygopalatine fossa via sphenopalatine foramen only. Angiofibroma is a tumor arising at the sphenopalatine foramen. Angiofibroma, it is a cancer, it is a tumor arising at the sphenopalatine foramen. Okay? Yes. So, next we are going to see osteometal complex. See the diagram. So, now in this diagram, yes, we are seeing the ethmoidal bulla ethmoidalis. Now, bulla ethmoidalis, which contain the most prominent anterior ethmoidal cell, which contains the most prominent anterior ethmoidal cell. Okay, right. And we have uncinate process. Uncinate process, it is a part of ethmoid bone. Uncinate process, it is the part of ethmoid bone. It is a part of ethmoid bone. Now, between the uncinate process and the bulla ethmoidalis, we have a semilunar gap, and that gap is called hiatus semilunaris. Okay, so hiatus semilunaris, please underline, and that is the semilunar gap. That is the semilunar gap between these two. Okay, so this is our hiatus semilunaris. So that is our hiatus semilunaris. Hiatus semilunaris is the semilunar gap between the bulla ethmodalis and uncinate process. Now, if you go inside the hiatus, semilunaris, then we have a three-dimensional space, and that is called ethmoidal infundibulum. Now, see this area? I'm shading, no? So this part, I'm shading in white color, no? That is our ethmoidal infundibulum. I'm writing as E. So that is the three-dimensional space which is present inside the hiatus. So the one which I marked as E is our ethmoid infundibulum. Ethmoidal infundibulum is nothing but it is the three-dimensional space which is present inside the hiatus. Again, if you go inside the ethmoid infundibulum, then we are seeing the ostium of the maxillary sinus. That is our opening. That is the ostium of maxillary sinus. The opening of maxillary sinus. Now, the three structures, what are those? I am going to mark the hiatus semilunaris number 1, this ethmoid infundibulum number 2, and this ostium of maxillary sinus number 3. So, these three structures are called osteometal complex. So, osteometal complex is formed by number 1, hiatus semilunaris, number 2, ethmoid infundibulum, number 2, ethmoidal infundibulum, and number 3, ostium of maxillary sinus. Okay. Now, these three structures are called osteometal complex. Now, osteometal complex which receives three sinuses open into the osteometal complex. Three sinuses which open into osteometal complex. Okay, what are those? The frontal sinus, anterior ethmoidal sinus, anterior ethmoidal sinus, and maxillary sinus. Okay, so the three sinuses open into the osteometal complex. So now any block in the osteometal complex, now these sinuses not able to drain the secretion, which in turn result in frontal sinusitis, anterior ethmoidal sinusitis, and the maxillary sinusitis. So osteometal complex which receives frontal, anterior ethmoidal, and the maxillary sinus. Okay, right. Now see the diagram. Now in this diagram, yes, we are seeing the meatus. Now what is meant by meatus? See, meatus are nothing but the spaces which are just lateral to the turbinates. So we have some projections. See, now this is the lateral wall. Now lateral wall, yes, we are seeing some projections like this. Now if you remove the turbinates, in the lateral wall, we see some spaces. So those spaces are called meatus. So meatus are called, they are the spaces which lateral to turbinates. So if you remove the turbinates, then you see the meatus, lateral to turbinates. Okay, right. So now this is our inferior meatus. I am writing as I. This is the middle meatus, and this is superior meatus. Okay, so I is the inferior meatus. Now in the inferior meatus, nasolacrimal duct is opening here. So inferior meatus which receives nasolacrimal duct. Okay, right. And the middle meatus, in the middle meatus we have the osteometal complex. I'm going to zoom this image so that you get a clear picture. You can see the osteometal complex in the lateral view. So this is our bulla ethmodalis, and below the bulla ethmodalis we have uncinate process, and between the bulla and the uncinate we are seeing the semilunar gap, and that is called hiatus semilunaris. If you go inside the hiatus semilunaris, then we have a three-dimensional space. I'm putting some dots now. Yes, that is our ethmoid infundibulum. I'm writing as EI. If you go inside the ethmoid infundibulum, then we are seeing the opening, the ostium of the maxillary sinus. Okay, yes, these three structures, the hiatus semilunaris, ethmoid infundibulum, and the ostium of maxillary sinus. Now, these three structures called, yes, osteometal complex, which receives frontal sinus, maxillary sinus, and the anterior ethmoidal sinus. And see this diagram. Now, this is the superior meatus. Now, the superior meatus, which receives posterior ethmoidal sinus. So, posterior ethmoidal sinus, which open into the superior meatus. This one. That is the opening of posterior ethmoidal sinus. And last one, this is our sphenoethmoidal recess. That is our sphenoethmoidal recess. Sphenoethmoidal recess, which receives the sphenoidal sinus. Which receives sphenoidal sinus. Okay, right. Now, these are the various sinuses which open into the lateral wall of the nasal cavity. Okay, so very simple topic and very small topic, but again the high yield topic. We are getting questions repeatedly from this 2021 INACT exam. Yes, they gave the cadaveric image and they marked the sphenoidal sinus. The marked sinus opens into which of the following. Likewise, they framed the question. Okay, right. So very simple topic and small topic, but again high yield topic for the INACT, NEET and FMG exam. So now we're going to see some animations for the lateral and the medial wall of the nose. Now first orient yourself to this image first. Okay, we'll see the animation later. Before that, try to orient yourself. Now you're seeing the skull from the front view. Okay, we removed the mandible. Okay, so now this is midline. So exactly in the midline, you are seeing the white structure. That white structure is our septal cartilage. So septal cartilage, yes, it is forming the medial wall of the nose, nasal septum. Now just lateral to that, you are seeing some projections. That is the lateral wall. Okay, we're going to see the animation. See the lateral wall. That is the lateral wall of the nose. Now what are the bones forming the lateral wall? First bone is the inferior turbinate. Inferior turbinate, it is not the part of ethmoid bone. It is a separate bone. Okay. Whereas middle turbinate and the superior turbinate, they are the part of ethmoid bone. Now we isolate the ethmoid bone. Now we are seeing only ethmoid bone. Okay. Now ethmoid bone, in the roof, we have the cribriform plate of ethmoid. So superior view, cribriform plate of ethmoid, which is pierced by olfactory nerves. Now in the midline, you are seeing one perpendicular plate of ethmoid forming the medial wall of the nose, that is forming the boundary for nasal septum, perpendicular plate of ethmoid. And we have some turbinates, projections in the lateral side. We have two turbinates, middle turbinate and the superior turbinate. See the color? Yes, the blue color and the green color, they are the turbinates. Blue color is a middle turbinate and the green color is a superior turbinate. So superior turbinate and middle turbinate, they are the part of ethmoid bone. Whereas inferior turbinate, it is not a part of ethmoid bone, that is the separate bone. Okay, now we're going to tilt the ethmoid bone. So that is the inferior turbinate, that is not a part of ethmoid, it is a separate bone. Okay, so now one more process we are seeing, that green color process now, yes. The green color process is nothing but our uncinate process. That is extension from the ethmoid bone. That is the uncinate process of the ethmoid bone. Okay, that is helping in the formation of osteometal complex. Yes. Now next, we're going to see the medial wall of the nose, nasal septum. So that is the inferior turbinate and superior turbinate and middle turbinate, ethmoid bone. So we're going to remove ethmoid bone and we're going to remove the inferior turbinate. So now we can see the medial wall clearly. So nasal septum we are seeing. We remove the lateral wall and we are seeing the nasal septum. Now here one cartilage forming the nasal septum. Which cartilage? Septal cartilage, also known as quadrilateral cartilage. Again we have perpendicular plate of ethmoid that we have removed along with ethmoid bone. And one more bone giving the contribution is the vomer bone. So three structures contribute for the nasal septum. Two bone, one cartilage. Vomer bone, perpendicular plate of ethmoid and the septal cartilage. These three structures form the nasal septum. That's all about the nasal cavity.